Fluorescein is a dye that we use that picks up damaged areas, okay? Well, if you look at that bottom picture, the entire eye is picking up the fluorescein, okay? That's an eye that ultimately may end up looking like the prior one, okay? So, get it in your eyes, burning, tearing, severe pain, damages the cornea and the lens. Get it in your lungs, cough, shortness of breath, wheezing, laryngitis. You can get a chemical pneumonia if you get it further down, okay? Bloody sputum, okay, with severe exposures. Get it on your skin, chemical burn, and it may well be a deep necrotic burn. And if someone is stupid enough to ingest it, okay, it will destroy the GI tract. Some of the worst cases I have ever seen of anything are patients who ingested alkali and just destroyed their esophagus and stomach. That's what this stuff will do, okay? So treatment, no surprise, remove them from the exposure, decontaminate them if they're a liquid exposure, wash their eyes out, irrigate their eyes. And when I say irrigate their eyes, that means from the time you contact them until you deliver them to the hospital. Irrigate their eyes, okay? And then airway problems, intubate if you have to, positive pressure ventilation. Chlorine, you all know what chlorine smells like. Obviously we use it in swimming pools. Significantly irritating, okay? Green yellow gas, when you mix chlorine with water, it produces hydrochloric acid, okay? So take a good whiff of chlorine gas, nose, throat, water, 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 okay? In your lungs, water. What are you doing? You're essentially creating a hydrochloric acid burn of all these areas. In addition, you get free oxygen radicals. Free oxygen radicals are incredibly damaging to tissue, and the gas with the combination of hydrochloric acid and free oxygen radicals, 30 times more irritating to the lungs than hydrochloric acid alone. Amazing stuff, okay? So airway, lung damage with high concentrations, pulmonary edema, irritation, cough, dyspnea, shortness of breath, all that good stuff. Treatment, same. Get them away from the exposure, wash them off if necessary, oxygen, intubation, positive pressure ventilation, okay? And phosgene, this one's the interesting one. Used a lot in World War I, still available, used in a lot of manufacturing and industry, okay? If you're old enough to remember this incident, anybody here old enough to remember, besides me? Bhopal, okay. Bhopal, there was a release of essentially 25 tons of methyl isocyanate, okay. Methyl isocyanate is phosgene and isocyanate. Those are the injuries. In India, the company that released this, American Cyanamide, said there were 150,000 affected, 10,000 severely, 3,000 killed. If you talk to the folks in India, they say the number was twice that many. Okay, so bad stuff. Phosgene, colorless gas, smells like freshly mowed hay. Let me make a comment about that for a second. This is not a detection device, okay, and should not be used as such. If you can smell phosgene or mustard or any of these other chemicals, you're too close, okay? So don't depend on your nose. Heavier than air, so it accumulates in low-lying areas. Gas most of the time, okay? When you expose phosgene to water, you get hydrochloric acid once again, okay? So we'll get irritation in the eyes, nose, throat, and lower airways. The thing about phosgene is because it's not so water soluble, it gets down deep into your lungs, okay? And the problem there is the damage it causes is delayed, anywhere from 2 to 24 hours. So once again, these people need to be transported and watched, even if they are asymptomatic, okay? If they get the lung damage, the alveolar damage, they develop a non-cardiac pulmonary edema, and they will put out as much as 1 liter of fluid into their lungs every hour. Okay? They are literally drowning in their own secretions. Okay? 1 liter per hour. How long is it going to take somebody to get dehydrated? What's our normal blood volume? How much? Little high. 5 to 6. Okay? 1 liter per hour. How long is it going to take you to get dehydrated? Yeah, hour and a half, 2 hours, 2.5 hours. Okay? So, unlike a cardiac pulmonary edema patient, these folks are becoming dehydrated. So, you want to treat them with fluid. You want to replace the fluid about as fast as they're putting it out. Okay? This is a non-cardiac pulmonary edema, and they're literally drowning. Okay?
Is CPAP still going to be?
I would absolutely try CPAP and see if that helps. Okay? Recognizing that if they're putting out fluid this quickly, okay, it's going to be CPAP, suction, CPAP, suction. Okay? So it may be easier in some of these patients, quite honestly, to get them intubated and positive pressure ventilated in that fashion. The mild ones, I would absolutely try CPAP on. Okay? Great technique. Thing about these patients is, okay, yeah, remove them from the exposure, manage their ABCs like before. You do not want them to walk from the scene to your ambulance. Okay? You do not want them to exert. The more they exert, the more the phosgene they're going to get down lower into their lungs, the more damage that will occur. Okay? So all of these patients should be stretchered from the point of contact to your ambulance. Do not allow them to exert themselves. It just makes the pulmonary edema worse if you get more phosgene down lower into the lungs. Okay? And then once they get to us, we're going to have to watch them. Okay? Even if they're asymptomatic, we're going to have to watch them. So keep an eye on them. Okay? So phosgene, majorly toxic to the lungs. In non-cardiogenic pulmonary edema, manage them with fluids as necessary and all this standard airway stuff. Okay? Cyanide. You all should be very familiar with cyanide as firefighters. Okay? Hydrogen cyanide. Very volatile, comes as a gas. Okay. Once again, your nose is not a detection device. We talk about the smell of bitter almonds or burning rope, but half the population can't even smell it in the first place. And if you can smell it, okay, get the hell out of Dodge. Onset within seconds with high concentrations. Okay. Cyanogen chloride also releases cyanide, very volatile as well. Again, onset within seconds, okay, of exposure. You all know how it works. I'm not going to belabor the chemistry. The important point is cyanide interferes with the ability of our cells to use oxygen. We have lots of oxygen. Our blood is loaded with oxygen. The cells can't use it. The cyanide interferes with that, okay? So we become acidotic. We get a lactic acidosis, etc. Our brain says we don't have enough oxygen. So if you don't have enough oxygen and your brain realizes that, how do you respond to that? Yeah, increased respiratory rate, okay? Increased heart rate in an effort to get more oxygen. The problem is you already got enough oxygen, you just can't use it, okay? Your heart, increased rate, cardiac dysrhythmias, eventually failure, okay? If you look at the blood that you drew when you started the IV, it's bright red. It's got all the oxygen the victim needs. The problem is they can't use it, okay? So your clue is this is a patient who has respiratory findings and no cyanosis, okay? Rapid onset, loss of consciousness, collapse, seizures, literally within seconds to a couple minutes, okay? Low concentrations, however, onset is more gradual. Headache, anxiety, weakness, lightheadedness, vertigo, ataxia, nystagmus, muscle, a lot of that sounds like carbon monoxide, okay? If you are dumb enough to ingest the stuff, okay, belly pain, vomiting, diarrhea, all that same stuff, okay? So we're going to see increase initially in the respiratory rate, increase in the heart rate. As things get worse, you get respiratory depression, respiratory arrest, cardiac arrest, seizures, etc. Okay? Get them away from it, decon them if necessary, and of course the primary therapy for cyanide is cyanokit. Okay? The slide talks about 100% oxygen. Yeah, that's nice. They already got more, all they can need. Okay. Hydroxycobalamin or cyanokit. Cyanokit's an interesting product. Got approved in the US in 2006. Had been used in Europe probably for 15 years before that, before we in our infinite wisdom decided we would accept it. Okay. The nice thing about hydroxycobalamin is it binds with cyanide. It forms cyanocobalamin. That's vitamin B12. So the patient's really happy. Okay. There's the dosage. I'm not going to belabor dosages. It does have some side effects, the most notable of which is increased blood pressure. So if you give it too fast, the blood pressure goes way up. Slow down the infusion. Okay. And red urine. Warn the patient. Okay. The urine's going to turn red. Okay. This is the good old days. The old cyanide antidote kit. Nitrite and thiosulfate. The nitrite would pull cyanide away from hemoglobin. The thiosulfate would combine with the cyanide. We peed it out in our urine. The kit looked like this.